Hi, this is Dr. Ronald Morton, the Chief Medical Officer at Texas Therapeutic Medical Specialties. Our passions here at Texas Therapeutic Medical Specialties really center around three primary entities. One is the dizzy patient. Patients that have dizziness have such an alteration in their quality of life that when it hits them, they want to get something done about it right away. And the longer it goes on, the worse they seem to get. So one of the things that we're passionate about is when that person calls with a flare-up in their dizziness, we get them into this clinic as fast as we possibly can, because the sooner we can do the evaluation and do the intervention, the quicker that patient is going to get well. Whether that's just with specific therapeutic movements here in the treatment room where we are now, or whether it's intervention under the microscope to try and introduce medications directly into the ear to stop problems, or getting them into a vestibular therapy or dizziness therapy program, that's what we do. Secondly is that sudden hearing loss, the people that will suddenly lose their hearing inexplicably, and we know the reasons why that can happen. But the biggest problem that I run into is when somebody has that problem, they call and there's a delay in getting the appropriate treatment that they need. And the longer you delay, the less likely is the chance that we're going to get that hearing back or get it as good as we possibly can. Here in our clinic, when somebody calls with sudden hearing loss, they come in that day or the next day if we can at all possibly get them in to intervene as fast as we can. We know from research that if the problem goes on several weeks untreated, our ability to bring it back is going to be much, much less. And unfortunately, that's what all too often happens with patients. They call and can't get in to see their specialist for a period of 5-6 weeks. And at that point in time, sometimes it's too late. And then thirdly is the treatment of sensory processing disorders, especially in children. I've been experienced and blessed to be able to do that in specialty centers since 2007, when I really started specializing in vestibular problems and sensory processing problems. Those children, unfortunately, are difficult to diagnose, and in the medical community, they're sometimes treated in ways that may not be the best for some of those children. Medications are used oftentimes, or other diagnoses are applied to those sometimes, that if you look at the sensory processing of those children, you can really see the problem and find out what it is that you may better be able to do than just treating the child with more medications or placing them in a diagnostic category. What we do here is to look at the way the child functions, where is the dysfunction, and then we come up with an objective way to treat a problem that we can objectively see with our equipment here. Whether it's therapy, whether it's dietary intervention, inflammatory immune system intervention, exercise therapy intervention, whatever we need to do, the faster we can get ourselves involved in that, I think the better it is we're going to be able to handle those problems. So those are the passions of our clinic here. We do a lot of other things, but those three things are really close to our hearts here, and that's really what we like to try and help people with here in E6s.